Good afternoon from the annual meeting in San Diego. We're pleased to be here today with Dr. Vance Thompson. Thanks a lot for being with us this afternoon.
Thank you for having me, Jonathan.
Vance, I think a really exciting technology for refractive corneal surgery is SMILE. And SMILE has been on the forefront of refractive treatments overseas for quite a while and is now just making waves in the United States. Can you please give us an overview of where SMILE has been and where we are now in the United States with this treatment?
Well, SMILE has quite a history internationally. In this country, I've been one of the FDA monitor investigators for the sphere-only trial for myopia, and then that became FDA approved, and also was in the clinical trial for sphere and cylinder, and then that became FDA approved. But we still have a very young history in the United States compared to the rest of the world.
So it seems that more corneal refractive surgeons in the United States would have been exposed or trained on excimer treatments, and now it's sort of a matter of, I guess, retraining many of the surgeons who are currently performing excimer surgery. What is that training process like for learning SMILE for somebody who already is an existing refractive surgeon?
Well, we've grown up with PRK and LASIK, and so we're comfortable with that. And what's fortunate is it's really no different doing a SMILE evaluation. I actually kind of think of it like a LASIK evaluation. And those patients with thin corneas or times when we wouldn't want to do a flap, we're doing PRK. But the rest, anybody that's a LASIK candidate is a SMILE candidate.
Well, that's what I was going to ask. Is in your practice, or as you foresee practice in the future, where many different refractive technique options are available, how do you go about selecting the right technique for each individual scenario? Is it based on things like corneal thickness, or ocular surface disease, or extent of myopia, for example?
Well, we still rely heavily on level of correction,
Hmm.
how their topography looks, corneal thickness, and then, of course, we educate patients. And what I enjoy about offering PRK, LASIK, and SMILE is I can educate the patient on that and then help them make a decision. And I like to give them a recommendation, but I also like to imagine what decision would they make for their situation if they knew what I knew. And that's my goal in patient education.
Yeah.
And you would be amazed, Jonathan, when you do that, how many patients want SMILE.
Yeah, well, let's get specifically into that, Vance, because I'd like you to explain, if you can, some of the real advantages that SMILE may offer that may benefit the patient in both the short and long term, and how do you propose or explain that for the patient?
Well, remember we got advantages and disadvantages to PRK and LASIK. One of the things we love about PRK is corneal strength. One of the things we love about LASIK is visual recovery. And one of the things we like about SMILE is it combines the benefits of both of those procedures. We get the benefits of PRK and we get the benefits of LASIK. And what resonates with the patients is not only to get the quick vision return of LASIK that they're looking for, and so what resonates with SMILE patients is to get that quick vision return, but they like the idea of less of a side cut and leaving their cornea in a stronger state. And it resonates loudly with patients.
Well, that makes good sense, and this may sort of parlay into us shifting gears a little bit to side effects, because we have known now for some time that one of the biggest side effects from LASIK is ocular surface disease and dry eye, and we know that has to do with the way the corneal nerves are severed during the flap creation and some other variables. Do you think that that's as much of an issue with SMILE, or do you think that those types of side effects, such as surface disease, are more along the lines of what we might see with PRK?
Well, one of the most important aspects of SMILE is the femtosecond laser is working under 120 microns. So it's leaving the strongest portion of our cornea that's been proven over and over, it's leaving that basically untouched compared to PRK and LASIK. And so it's also minimizing disruption to the superficial nerve plexus. So we see less dry eye and foreign body sensation. But because we're also preserving those strong anterior corneal fibrils, we see stronger biomechanics. And those both really resonate with the patient.
Yeah, I recall that from a lot of the initial data out of Europe and Asia and some other areas, that this is a promising technique for people with very high myopia that may not be candidates for traditional excimer laser.
Right.
Do you have a range or an upper limit that you would consider treating someone with SMILE?
As long as the math works, I would go to the full limit of FDA approval, and that's -10 spherical equivalent myopia and 3 diopters of astigmatism. And one of the beauties, since you're operating within the cornea and you're not removing epithelium, you're not lifting a flap, you don't have dehydration working against you, you would be amazed how level of correction minimally affects refractive accuracy. And that was one of the most profound findings we found, was refractive accuracy. And to tell you the truth, as our techniques get better and better and we understand our energy settings, the lowest amount of energy to do the job, the day 1 20/20 rate is really high too, which is wonderful.
That's really impressive. I'd like to close for a moment and ask you about retreatments or touch-up treatments. I know that in the earlier days, this had been somewhat challenging with SMILE. Where are we now in terms of what we can offer in terms of touch-up treatments or retreatments with this technique?
Well, for one, the retreatment rate should be low. And in well-trained hands, it should be in that 1 to 4% range. But some people will need it. My preference right now is PRK. There are centers doing thin flap LASIK over SMILE, but I prefer PRK as an enhancement. And I actually educate the patient before we start the SMILE journey about if we need a fine tune, that's what your fine tune will be in my hands.
Well, that makes great sense. I'm so glad you're able to share your expertise with us today about SMILE and how it's gaining traction in the United